Okay. So welcome again. Our title today is our PFAS, Health, Environment, and Different Decisions. We're going to be hearing from 3 different presenters. We have Susan Buchanan from the University of Illinois, Chicago, their public health school. We have Dr. Mila Marshall, the clean water advocate from the Sierra Club's Clean Water team. And we have Commissioner Cam Davis from the Metropolitan Water Reclamation District. We are going to hop right in. Okay. So we have, from the UIC, we're going to be understanding how health exposure and impacts the well-being. The environment will be from the Sierra Club and how PFAS gets into our waterways and through different regulations. And then with the MWRD, we're going to be learning about the MWRD system, different monitoring practices, and developing an action plan. Again, at the end, we have questions and answer. So please feel free to send any questions to me along the way. We have our presenters here. Oops, I'm sorry about that. Oops. How did I do that? Okay, sorry. So we're going to start with Susan. Susan, feel free to take it away.
All right, great. I assume you can hear me. All right, good. Hi, everybody. It's great to be here. I am from the University of Illinois, Chicago School of Public Health. I am an occupational and environmental medicine physician, which is a little niche field that no one's ever heard of under preventive medicine. I used to be a family physician, but this is a lot more fun. And I want to point out the logo in the bottom right, that small pediatric environmental health specialty units. That is a grant from the EPA and the CDC, specifically the Agency for Toxic Substances and Disease Registry, a really terribly named agency at CDC, ATSCR, and they have funded 1 center of expertise in each of the 10 EPA regions for healthcare providers on children's environmental health. So I direct that grant at UIC. Next slide. Because I'm a grant recipient, I have to include, I think, can you go the other direction? There might have been should be an acknowledgement slide next. There we go. Because I'm grant funded, I have to put in this acknowledgement and a disclaimer that I don't have relevant financial relationships. I don't represent EPA or CDC ATSTR in this talk. Thanks. Next slide. Okay, so I think some of the other presenters will include this too, but let's just get this straight, what PFAS chemicals are. There's this broad class of polyfluorinated chemicals, PFCs. So that includes all the PFAS chemicals, which is the term that is now being used. Some people have heard PFAS used commonly. So if you look at this family tree, you see that right branch is the perfluoroalkyls, and the left branch is the polyfluoroalkyls. And per just describes where on the atom, where in the molecule the carbon and the other molecules are. So then you see that PFAS is one of the perfluoroalkyls. It is one of around 5,000 PFCs. So we're talking about many chemicals. But today they are considered this group of PFAS chemicals. Okay, next slide. And if we're going to talk about health effects of any type of exposure, we need to show that humans are getting it into their bodies. And this is a really critical step when we talk about health effects, when we worry about health effects from exposures. So in fact, we do know about PFAS in the blood because the CDC does an exam every year of a group of representative people in the population. They draw all kinds of blood tests and they publish them. So here are the blood levels of different types of these PFAS chemicals over time. And you can see that PFAS has come down quite a bit since the cycle in 1999-2000. And all the others are present there. One thing that is not shown well on this slide is that even though those levels look low in the blood of Americans, we still all have PFAS chemicals in us. A study from, I think it was 2013 or something, showed, maybe it was 2008, over 96% of us has these chemicals. I can't imagine anyone anymore doesn't have PFAS chemicals in their blood. So we do know we're being exposed. Next slide. And then this is another one showing a comparison of levels of one particular PFAS or PFC. And this is, again, the PFOS, whose manufacturer has declined in the last 20 years. But this shows a comparison of the different levels. And if you start at the bottom, you'll see the general US population in the 2017 and 2018 monitoring cycle was down there 4.3 compared to the other light blue up in 2000. And so this again shows PFAS has come down. But then you see some occupational exposures there in the orange, manufacturing workers back in 1998 with huge levels. I mean, this graph doesn't even depict that comparison correctly. And then the rest of these are communities that have been exposed in their drinking water, either from living near manufacturing or living near military bases where aqueous firefighting foams are used for training purposes. Next slide. So what does PFAS do when it gets in the body? This image shows this. If you start at the top, PFAS chemicals are rapidly absorbed following oral or inhalation exposure, so either ingesting them or breathing them in. And then they get distributed widely throughout the body, but the highest concentrations are in the liver, kidneys, and blood. Down at the bottom there, you see that they are not biotransformed or metabolized. That means we do not break down these chemicals in the human body. They stay as is, but we use our livers to try to detoxify what we take in so that we can pee it out or breathe it out or poop it out. But these chemicals are not metabolized. They stay in the form that you breathed them in or you ingested them in. They are eventually eliminated in the urine, with smaller amounts eliminated in feces and, yes, in breast milk. Now, I mentioned there were thousands and thousands of these chemicals. They have different lengths of their carbon chain, with the fluorine atoms attached on the outside, sometimes chlorine, sometimes bromine. The shorter ones, carbon chains, tend to be eliminated faster than the long chains. And once again, there's thousands of different types. And the elimination rates do appear to be different in males and females. Next slide. How long do they remain in the body? So here's just an example. I do want to mention, I keep saying there are thousands of these. We do not know about the health effects of the vast majority. We don't know how long they stay in the body. We haven't measured them in the blood. We don't know what the health effects are. So the knowledge we know now, in my opinion, is in its infancy. So for example, here we got 4 of them that we know how long they live in the body. So PFBA, you see, is just a matter of hours before you pee it out. But PFOA next to it lasts anywhere from 2 to 10 years. PFOS up to 27 years. PFHXS up to 35 years in your body. That's why we say that everybody's got some PFAS, some type of PFAS, because they can last so long in the body. Next slide. So, and why do we care about it? This is a nice graph from the National Academies of Science about why do we care. Actually, I think maybe I got this from ATSDR. Anyway, widespread human exposure. EPA considers it a contaminant of concern. It may bioaccumulate. I'm just kind of going from top to bottom, left to right. So when it stays in your body for 27 years, it's building up all of those exposures over 27 years. We know it may affect the developing fetus and the child. It crosses the placenta, is excreted in breast milk. We know it may increase cancer risk. I'll get to that in a minute. It has long half-lives, as I showed you in that previous slide. Oh, and what I forgot to mention is those numbers of years were half-lives. So that's not how long it takes to get excreted. That's how long it takes for half of it to be excreted. So a half-life is the amount of time that the amount comes down to 1/2. And so it continues on after that. So you still have it within you. Next slide. So I want to mention what I'm using for my health risk summary, and that is this amazing report that came out in August 2022 from the National Academies of Science, Engineering, and Medicine. So that's where people like me get our gold standard information. So the NASEM report was commissioned by the CDC, the branch of the CDC called ATSDR, Agency for Toxic Substances and Disease Registry. And their statement of tasks, so they collected a group of experts in the field, and one of their tasks was to review the human health literature for health effects. So at least as of 3 years ago, probably 2021, when they were writing this up, this is the gold standard for what they thought was the evidence for human health effects. They also touch on blood testing, which I'm just going to talk about very briefly. Next slide. So this slide is basically the whole point of my talk. This is what the National Academies of Science, who got together these gods of environmental health, and they reviewed the literature. This is what they determined were the evidence categories for health effects. So if you look up at the top, this is the category where there is sufficient evidence of an association. And I'm sorry that this writing is really small, but there's high confidence based on strong evidence of these 4 health outcomes from exposure to PFAS. Decreased antibody response. So what that means is a less robust response to vaccines, to infection. For example, if you get an infection, your body develops antibodies so that next time you see that bacteria or virus, you can attack it and kill it. So there is evidence, strong evidence of decreased antibody response. Dyslipidemia just means high cholesterol, but in adults and children. Decreased infant growth, decreased fetal growth, and increased risk of kidney cancer in adults. So those are the 4 things that the National Academies expert group says there is sufficient evidence. Now, the next category, the yellow one there, orangish yellow, is limited suggestive evidence. So that means there is some evidence. There's moderate confidence, but it didn't meet the requirement to say that there was a high confidence. So there is evidence, although it's limited, of breast cancer, elevated liver enzymes, preeclampsia, testicular cancer, thyroid disease, by which I mean hyperthyroidism, hypothyroidism, and ulcerative colitis in adults. Now, the next one is there's inconsistent evidence or lack of evidence of association between exposure and outcome. And I'm going to, well, I'll go through these here and then I have another slide on them. But so these immune effects, other than this decreased antibody response, there isn't enough evidence to say that there's any other immune evidence. There's no other evidence that there's heart problems other than high cholesterol. There's not enough to say there's developmental outcomes to the fetus or young children except for this birth weight issue. No other evidence, strong evidence of cancers other than kidney, breast, testicular. Same for reproductive disorders, endocrine disorders, thyroid levels other than this thyroid disruption that was described above, liver, et cetera, et cetera. So neurologic effects. I think that's an important one. There is not sufficient evidence to say there is neurological effects from PFAS. Next slide. So this is, again, this list of inadequate or insufficient evidence. And I made an extra slide on this because this is one that these effects appear in a lot of websites of people who are concerned about PFAS. So it's important to know that besides what were in those strong evidence and suggestive evidence boxes, there isn't enough to say these issues have sufficient evidence. Next slide. So this, I'm not sure why that title didn't, oh gosh, this is kind of messed up. Anyway, that's all right, we can read it. This is the part that really interests me as a physician because those of us in these environmental health specialty units have been saying for years that don't get blood levels. When people would call us, I think I'm exposed, what do? We say, don't get blood levels. We don't know what they mean. we don't know what level confers what level of risk, if any. Well, this group at the National Academies got all literature together and said, okay, now we have enough knowledge, we have enough literature, scientific evidence to say we're developing cutoffs. So now they're saying if you have a known exposure, if you are one of these communities that had biosolids, from the local sewage treatment plant on your agricultural fields that happened in Maine, that leaked into their wells, and so their drinking water is contaminated. If you live near a military site, if you know they're contaminated, you should get a blood level. And here's what the blood level means. Less than 2 nanograms per ml as a result means you're in the second percentile of US population. That's pretty darn low compared to everybody else. No evidence of health risks there. Once you get between 2 and 20 as your result, then you need to make sure you're getting your cholesterol screened as recommended. If you're pregnant, make sure you get your high blood pressure checked, et cetera, et cetera. If you are between, you can't see that up there in the red. If you're over 20 nanograms per ml, then you need to do some extra testing with your doctor. You need to be getting your cholesterol checked. You need to be getting your thyroid checked. You need to be checked for testicular cancer and ulcerative colitis. I'm sorry, the format didn't transfer very well here. But for healthcare providers, we love this stuff. Okay, we are taught, don't order a test unless you're going to do something about it, which is kind of the status we were at. And now we actually have something we can do based on a result. Now, we can talk maybe in the question and answer period, how do you get a blood test? Because I can guarantee you that the vast majority of healthcare providers don't know about this. This has been really specific to the environmental health world that I am in. It's really hard to get the word out to doctors. So in my clinic, I can draw these at UIC. They're really expensive, hundreds of dollars. Some insurances seem to cover, others don't, but I do have a diagnosis code that I can put into insurance. So like I said, we can talk about that more if we want to. Next slide. I did want to mention children because I received a nice grant from the EPA to focus on children and environmental health. And the reason the EPA and CDC fund us for that is that children are a unique population when it comes to environmental exposures. So, and why is that? Several different reasons. They live a long time, so they can meet the cancer latency time period. So if there's a carcinogen, they're going to live long enough to get it. They put things in their mouths, so things that are on house dust and soil, they will get more of. They, per body weight, compared to adults, they drink more water, eat more food, breathe more air. They're little metabolic machines. So if there's anything in the environment, air, water, and soil, the kids are going to get it. Get a higher blast of it than adults. So the NASM, National Academy of Science and Engineering Medicine, report said for children, we found sufficient evidence for decreased antibody response, this high cholesterol, and decreased birth weights and fetal growth. Next slide. And then we also consider, of course, people who are pregnant to be a special vulnerable population because PFAS does cross the placenta. So you're blasting the fetus with these chemicals. Fetuses or newborns these days have dozens of chemicals. These tests have been done. You draw their blood from the cord, the umbilical cord, as soon as they come out, and it's full of chemicals. So we do know that a lot of chemicals cross the placenta. And so there is limited or suggestive evidence of liver enzyme and increased pregnancy hypertension. Next slide. And on my last couple slides are just an ad for our center with this awkward name, Pediatric Environmental Health Specialty Units. I can't even say it, we're called PACEs. There's one of us at each EPA region. So you see ours at UIC covers these 6 states. And we're staffed by physicians, nurses, toxicologists, industrial hygiene for occupational exposures, and we cover reproductive healthcare as well. And we offer clinical consultations, telephone consults, clinic visits. We do outreach like these types of lectures. We have people who are exposed, call us, email us, say, what do I do? So that's what we're funded to do. Next slide, which I think is my last one. Yeah, and this is our team of, we've got a few people in each state that have some training. There's very limited training in environmental health. If you're not an occupational medicine physician, there are, I think, 3 fellowship positions in the country, graduates each year. So we've got, this is our team: industrial hygiene, medical toxicology, OBGYN. So we are here to answer your questions at UIC. And I think that's my last slide. Yeah, thanks.
Wonderful. Thank you so much, Dr. Buchanan. My name is Mila Marshall. I'm the Clean Water Advocate for the Sierra Club Illinois chapter. Hopefully you can hear me well. If you can, just drop in the chat where you are kind of participating from. We always love to know where in Illinois, in this case, might be across Cook County. And so really happy to be here talking about PFAS today. Next slide. Myself and the Clean Water team focus on a range of topics. More recently, we have been kind of ramping up our efforts to communicate PFAS literacy to diverse stakeholders. And so in this, we partnered with a medical doctor as well as Commissioner Cameron Davis to diversify how we talk about it. Next slide. So the Clean Water team has a process of protecting water, and we do advocate for clean water for all, and we say that, we kind of mean it. So I'll slow down a little bit. We do kind of focus a lot on education and literacy. In my role at Sierra Club, I realized that water is highly complex. It integrates with policy, biological systems at multiple levels, and even of governance. There's a high turnover of professionals. And when it comes to residents, homeowners, consumers versus those in the utilities and writing policies, there isn't many opportunities for people to listen and share. When I first started the role, also, maybe about 80% of Americans would learn about water from watching the news. And so we do know that it costs society to not have a strong understanding about water, its movement, what affects it. So water literacy is what we're really focused on, and we want to help you understand how this chemical and other toxins move through our system. We also advocate and we work to improve water conditions through various activities. But first, we have to build the community of individuals that understand what the issues are, so we could ask better questions and request and lobby for our resources to be allocated a little bit more wisely. And that brings us to action. And so we do hope that from this conversation, number one, your tension around this toxin, as you've seen it kind of move through media, Forever Chemical, or any movies that you've seen like Dark Waters, that this allows for you to feel a little bit more confident in the science, the people that are working on these issues, and be ready to take action at whatever level you are ready to. Next slide. All right, so really how PFAS moves through the environment is dependent upon the products that that it's coming from. There are thousands of products, from tooth floss to toothbrushes to textiles, that these chemicals are associated with, through the manufacturing process as well as through the decomposition process. Even through incineration and evacuation of plumes from factories. There are, I want to say, 15,000 or nearly 15,000 of these man-made chemicals, and they are all around us. Next slide. Sierra Club has been kind of following PFAS for a bit. There is a report that was published on fertilizers tested by our previous toxics advisor, Sonia Lunder, who's no longer with the Sierra Club. And we were able to identify dozens of fertilizers that were tested that had these chemicals in them. And so exposure of PFAS can happen through products and or the use of materials to grow food or on fields. Next slide. And so when speaking about PFAS, I never want to make it seem as though like this, to discredit like the rapidness of science without us understanding the harm that science and technology and advancements can induce. And so, yes, the use of Teflon made products stain resistant, right? Waterproof, as well as fire resistant and cold resistant. However, I do think that there were unexpected and unintended consequences of these products as they decomposed in our environment, and also have gone unregulated for far too long. We also know that they are within aqueous foam that's used for fighting fires like gasoline fires, oil fires, and even in jet fuel. And so while these chemicals have brought some value to our society and to our products, they also have caused an immense amount of harm. We do want to move forward with helping consumers understand their options, make wiser decisions, but also hold companies accountable for the products that they use, and do so through our federal agencies like Environmental Protection Agency, as well as state agencies like Illinois EPA. Next slide. And so, yes, we are deeply concerned about drinking water, and we, like I said, advocate for clean water for all. We want to help hold industries and factories accountable for their exposure. We know that thousands of Illinoisans, based on the study that was done by the Illinois Environmental Protection Agency, have been exposed to PFAS within their drinking water. There are a number of states that are beginning to sue the company DuPont for contaminating drinking water with PFAS chemicals. And we also know that regulatory agencies like EPA and IEPA are moving forward with collecting data and using science to make the best decisions on how to regulate PFAS chemicals and set water quality standards across the nation. Next slide. In doing so, as standards are set, it creates a bit of tension within systems that have to pay to upgrade their processes. For example, water quality standards designate use of bodies of water, for those that are unfamiliar, like what these are, that are set by EPA. Standards also create criteria to designate, to protect designated uses of particular bodies of water. And it also sets what's called anti-degradation requirements that protect the value of waters and high quality waters. And so at the bottom, I don't know if that's clear, but anti-degradation means that no pollution discharges or activities will be permitted if these activities would cause surface waters that already meet a water quality standard to drop below those standards. When we invite the public to give comments on permits or discuss toxins or impacts to water, the language can be very specific. And so the definitions of things like anti-degradation or the types of permits that are used when companies are asking to discharge can be the difference between a comment kind of being taken seriously or kind of pushed to the side. So that's another reason why we do these types of calls and talks, is that as we build the population of allies, it's getting everyone to understand the language that water is regulated as well. Next slide. So currently, there are no federal drinking water standards for PFAS in public water systems. And you can find information on PFAS in Illinois through the Illinois Department of Public Health's website, and also the Illinois Environmental Protection Agency's website. Next slide. And so PFAS basically gets into our water that it's legally discharged, right? Like this isn't coming from entities illegally discharging, but it moves through the system, through our drains. The best way that we believe that PFAS can be handled is by stopping producing products that use PFAS, right? But there are very few governments that regulate PFAS. We're one of the few states where we have pushed policies to really address this in some key ways. Next slide. I do want to lift up, I'm gonna pause for a second and throw this in the chat. This is a interactive dashboard that's available for the public. This is basically a snapshot that is from a sampling between 2020 and 2021 that IEPA did of public drinking water systems. And so the dashboard, you can kind of move around it, and that map that you're looking at of the state, the colors blue represent places where water was sampled and there was no detectable amount of PFAS within those samples. And then those in red and yellow is where there were trace amounts found. And so in Chicago, there was none found. I did have to remember to flag and say that. The city of Chicago actually has that posted on the government website, that they were one of those sampling sites, and there was no detectable amount of PFAS found in drinking water. And just to kind of put this into perspective, there is, if you look at the values of like what is a nanogram per liter. I put that on there to give a frame of reference. It's basically 1 part per trillion, right? So think of like a drop of water in 20 Olympic-sized pools. So that's just to give you some context for the small amount that can be found in a large volume and still cause harm. But that dashboard is not going to be updated, but it is valuable, I believe, for people that are interested in understanding how IEPA has tested public drinking water systems. Next slide. All right, so on to some wins and celebrations. You can give some hand claps with your emojis, or you can do a high five, because this is not easy passing these types of legislation. And so this is the PFAS Reduction Act. Oh, I see a hand clap. Thank you so much. Basically, it regulates the use of firefighting foam to minimize PFAS exposure and movement into our natural systems. And so very excited that this happened in 2021. Next slide. And then House Bill 4818, another round of applause, where it is the PFAS incineration bill. And this one was really also hard fought. And we look forward to more pieces of legislation kind of controlling PFAS, holding companies accountable. There is also a lawsuit being brought on DuPont by Kwame Raoul's office, and Sierra Club is in support of that as well. Next slide. Last but not least, in terms of how to stay engaged in next steps, if you are really jazzed up about continuing to learn about PFAS, we would love to invite you to participate on our local water teams. No level of expertise or experience is needed. We also have monthly working and local watersheds calls. So if you have questions or resources that you would like to make available to our water teams, or just want to pop your head in and see what's happening around the state, we definitely invite you to that. It is the 4th Wednesday of every month at 6 p.m. and you can email my colleague Ann Baskerville. Her email is on the slide. We do have water sentinel sampling teams. So if you're more active and want to sample water, we have been identifying the labs that can run these types of tests. We're not currently doing PFAS testing. People have asked us about PFAS testing and what that looks like. But working with Dr. Buchanan, I'm really excited to learn a little bit more about the landscape of testing water at the public level. I know it's available for those who feel that they've been exposed, but we have been receiving some requests from our volunteers. And then last but not least, in the event that your organization wants to continue the conversation for a special, group of stakeholders, the Clean Water team would love to participate and continue improving water literacy on PFAS and other issues. And my email is at the bottom as well. So next slide, I will pass it over to, after this, I have to say this, that regulating PFAS is complex. And yes, consumers are responsible for purchasing these products, and we are, ultimately responsible for our individual actions, but it's not enough. We absolutely need policy decisions at every single level for accountability and protection. And I'm so glad to introduce Commissioner Cam Davis that can speak to a little bit about his passion for water and helping you understand PFAS with MWRD. Thank you. Next slide.
Great. Thank you so much, Mila. And that's a great transition. In case you can't see me on the screen, you're on the phone or what have you, there's, I guess, another picture of me. Let's keep going. But do take note of that email address, davisc@mwrd.org, in case you would like to follow up after this presentation. What you heard before was I think a very good complement to what you're about to hear. Brendan, you can move on. Which during the first presentation, you heard a little bit about human health impacts. In the second presentation, you heard a little bit about policy needs as a part of the solution. What you're going to hear now in the third presentation is a heavy emphasis on what we as individuals can do to help on this very tricky, complex issue. Let me first start by giving a little bit of background about MWRD. That stands for the Metropolitan Water Reclamation District of Greater Chicago. Rather than say the Metropolitan Water Reclamation District of Greater Chicago at every turn, I'm just going to use MWRD, or the district. It's a public health agency at its core. It was originally founded, as you can see, in the late 1800s, essentially to help Lake Michigan as Chicago's drinking water supply. Given that the Chicago area was developed on interdunal systems in low-lying swampy areas and so on, essentially we had to find a way to keep wastewater from flowing into Lake Michigan, the original direction of the Chicago River, where it could contaminate drinking water and create public health risks to the population. As Chicago expanded and MWRD looked more holistically at what needed to happen, MWRD's responsibilities have also changed. We are in charge of, we oversee 882 about 882 square miles. That's Cook County's measurement. And as you can see from the map, except for the white areas, if you look just at the yellow areas, that is a lot of land. Cook County is the second largest county in the country by area. And so it could actually qualify almost as a small state. We oversee work in 120 plus communities. That's the city of Chicago, then 120 plus suburbs around the city. And often we think of Chicago when we think about wastewater and we think about the work that needs to be done, but often our suburbs are every bit as important as the city of Chicago, especially when you combine the population of the communities outlying around Chicago. We treat more than 1 billion gallons of water per year. That water comes from businesses, it comes from you, it comes from me. And very important, I think, to understand that MWRD's work is work on behalf of public health. One thing I always like to mention in presentations is that the district owns about 24,000 acres of public land. The agency is the second largest public property landowner in Cook County, second only to the Forest Preserve District. And so, with water in the district's name, it's often forgotten. Brendan, you can go to the next slide. It's often forgotten that land is also an important function of what MWRD does. I'm one of 9 elected commissioners. We essentially have the kinds of responsibilities that you see on the screen. One thing that's really important to understand is that we are elected by you to represent you. And so that means, just as you might visit a legislator or a congresswoman, our elected commissioners are supposed to serve you, the public. We are always trying to do our best to hear concerns and needs and understand where we need to be headed based on that constant communication with stakeholders. We are also in charge of setting the policy direction, the overall policy direction of the agency. And with, as you saw, a $1.2, $1.3 billion per year budget, 1.4 billion per year, about 1,300 staff people or so, it's a big agency that can do a lot of good. We as commissioners also provide oversight, financial oversight, for the agency. That means managing your taxpayer dollars, my taxpayer dollars. We pay property taxes that are essentially used to fund the agency's operations. My point with all of this is that MWRD is a public utility. I want to underscore this. Not a private utility. It is a public utility. It is owned by all of us who are residents of Cook County. MWRD is us. We are MWRD because the district essentially provides a critical function for all of us who live in Cook County. Next slide. So let's turn now to PFAS, the topic of today. We at MWRD, as I mentioned before, take solids from households, water as well, and businesses, and runoff from the environment that can often find its way into our water treatment system. And by system, we're talking about pipes, we're talking about plants, we're talking about pumps, all of the mechanisms, the machinery, and even the green infrastructure that's required to make sure that we take water that's been used and put it back into the world at least as clean as the way we have found it, often much cleaner. We have water in our name at the district, but solids are also part of the equation. As you heard earlier today by Sandra, when we poop, those solids go somewhere. One of the things that I often hear is, well, can't we just stop biosolids and leave it at that? Do they have to go somewhere? And the short answer is no, and it would be very uncomfortable for all of us if we did, because the biosolids that the district manages, that the biosolids that are treated, are in large part coming from us, human waste around the house, laundry waste from wastewater, from when we do laundry around the house, and so on. We'll get to that in a little bit more detail in just a minute. One of the things that the district does in order to treat biosolids and to treat water is to participate strongly in research to help better understand where PFAS may be coming from, how it might be able to be broken down. You've heard from Sandra and Mila, it's not easy to break down. It's a very stable chemical or family of chemicals. That doesn't mean that we're stopping or giving up. It simply means that we help fund research, we help conduct research, we conduct monitoring to help understand where PFAS may be coming from and how it reacts to different attempts to break it down. We sample a lot around Cook County in our intercepting sewers. These are the sewers that essentially connect our homes and our communities to the larger MWRD system. And let's go to the next slide. That testing happens on an ongoing basis. As I mentioned before, we test within the MWRD system in our intercepting sewers and elsewhere. We look at partnering to help understand better where PFAS is coming from, looking at alternatives to what we call forever chemicals, and so on. We also work, we also have our own authorities at the district, including the Sewage and Waste Control Ordinance under the Clean Water Act. It's our own ordinance, but we also operate at the district under the Federal Clean Water Act to keep moving our water discharges in the right direction, meaning cleaner and more safe for public health purposes. Next slide. This is really the nucleus of what I want to get to. When I mentioned that MWRD is us and we are MWRD because the district is a public utility, what does that mean for our purposes today? What that means is what comes out of our households goes into our wastewater system. We are not disconnected in our homes. We are not disconnected to the district. So what we do around the house really matters. The consumer and household products that we use on a day-to-day basis may contain PFAS or PFAS-related chemicals. And some of the kinds of things that we see PFAS or PFAS-related chemicals in include grease-proofing food packaging. That is up until very, very recently, as you can see in the box here. PFAS has been used in consumer products for decades. And so when you hear earlier, as you did from Susan, that PFAS is in 96% of our public blood, the blood supply, essentially it's coming from what we use around the household. And I'm going to get to that in just a second here. But I think the key is being informed consumers. When we bring PFAS-related products into our households, and then we use those products, it's almost inevitable that those PFAS building blocks or PFAS-related chemicals are going to wind up in the waste stream, which means they are going to wind up heading into the collection system like MWRDs, where then it has to be handled in some manner. So the kinds of things that we often see PFAS-related chemicals in are personal care products like lipstick and mascara. I saw a question in the chat earlier today about that. There's your answer. PFAS can be in our clothing. If you have water-resistant clothing, like a rain jacket or shoes or what have you, there is a chance that PFAS or a PFAS-related chemical has been used in the manufacture of that article of clothing. In furniture, it can be in carpeting, and so on. Around the household and the kitchen in particular, some of the things that you really want to look for are things that say non-stick, waterproof, stain-resistant, or wrinkle-free. Those can be clues that PFAS-related chemicals may be in that product that you're looking at. Non-stick coating, for example, Teflon coating in frying pans is something that's been used for decades. What you want to do is look for alternatives like non-stick ceramic, the good old-fashioned cast iron skillet that your grandparents used to have is still a very good alternative. Carbon steel, enameled cast iron. Those are the kinds of alternatives to non-stick PFAS-based cookware that you will want to take a very close look at. And then in the circle in this slide, you can see other things that may have PFAS in them. Nail polish, for example, dental floss. I've already mentioned raincoats and so on. So let's go to the next slide. PFOS and PFOA-free may not necessarily mean that there are not other PFAS-related chemical building blocks in those things. So what do you want to do? This is what, my family, my wife, kids, and I are trying to do every day. We are constantly trying to be on the lookout for where PFAS may exist and the kinds of products that we use around the house, and starting to move away from those and move towards safer alternatives. I want to suggest you just start with a checklist. The kinds of things that you use around the house, take a look, see if PFAS, if they may be associated with PFAS, and start to look for substitutes. You can read labels, you can do your own online research. I know we're all incredibly busy, but one of the things that we want to do is minimize our use of PFAS-related chemicals around our homes, around our households, so that A, we can protect our own health, our family's health, but also make sure we're protecting the health of whoever follows downstream of us as we do our laundry with PFAS-related clothing, as we flush, and so on and so forth. Let's go to the next slide. And here, just a very quick example, because I know we're running out of time, of the kinds of things that could go into a checklist as you begin to think about this and do your own research. Next slide. I want to wrap up with this incredibly important slide, and that is, none of us, we didn't create PFAS. We as individuals. MWRD did not create or manufacture PFAS, but we are all responsible. In addition to the policy work that you heard from Mila before, we're all responsible for trying to make sure that we leave the planet better than the way we found it. And that means doing our own work to research alternatives, move away from PFAS. But it also means holding those that manufactured PFAS accountable. And so one of the things that I am thinking about on a daily basis is how to navigate our policy solutions in the direction of making sure that our taxpayers, and I'm one of them, just like you, are not penalized for a problem that we didn't create, and that MWRD is not penalized for a problem that it didn't create either. We can move on.
Okay, thank you all of our participants. We're going to move into questions. So please feel free to add them into the chat. I did see one that was talked about earlier, which I was actually curious about, and it was with Susan about the dermal effects, the skin effects of PFAS on our skin. So feel free to look into the chat. The crux of it all was pretty much that there are several studies that are looking at the dermal effects and they didn't find any. So it seemed like it was in that middle category, if you remember with Susan's. Let's see, one of our questions, we have one for Cam, and it's here that, why has the district not required industrial sources to control their PFAS discharges using the district's pretreatment authority?
Mm-hmm. Yep, good question. The district is undertaking a lot of monitoring to understand whether or not industrial discharges are contributing, and if they are, how much PFAS to the system. As of now, some of the research nationally is suggesting that actually a bigger source, or at least as big a source, is actually us, our own homes, our own households, as I just mentioned.
Let's see.
I so appreciate that question because I think we're getting a lot of inquiries about how do we how do we trust the information that's coming from some of these reports? And that's kind of hard. Because especially like thinking about the data that was shared earlier about the products and, you know, from the consumer side, are you aware at all of like is the state of Illinois tracking or monitoring, or like how is the public made aware of like current information about PFAS exposure? Is it just with drinking water?
Mila, is that directed at me or?
Yeah. I'm wondering just like how the public can get access to these reports. You know, does the state or does the county, you know, have any idea of continuing sampling and reporting and making things kind of transparent and clear?
Sure. At the district, we're not on the drinking water side. The district, our utility in Cook County, is on the wastewater side and the stormwater side. So the water that comes in for all of us to use comes in through other entities. And my understanding is that the Illinois Environmental Protection Agency is requiring drinking water utilities here in northeastern Illinois and perhaps other places to monitor for PFAS, and that's where a lot of the information can come from. The U.S. EPA, not to be confused with the Illinois EPA, in other words, the federal United States EPA, also has really good resources about PFAS and drinking water on its website that anybody can access.
So I know we are right here, you know, kind of in our last minute. If there are, I see there are other questions that definitely require a bit of attention to. We want to let everyone know that we're willing to take those questions, provide some responses as we will make this recording available, as well as the slides, and respond to any questions that we were not able to get to in writing, and also a collection of resources that have come from this conversation today. If there are any requests specifically of the Sierra Club, for example, feel free to drop in the chat box your email. You can send it directly to myself, Mila Marshall, or Ann Baskerville, and we will stay in contact with you for your Sierra Club related questions. Brendan, I'll turn it back over to you.
Thank you, Susan. Thank you, Mila. Thank you, Cam. Thank you all and thank you everyone to the participants for joining us. We will be in touch with you all soon, and please feel free to reach out to any of us with any questions. I think we'll
Thanks,
wrap it up.
everybody.